Welcome back to TV5 News at 9. It's time now for Medical Moments. Joining us this morning is Dr. Joseph Contino, a surgeon with Covenant Cancer Care Center. Thank you so much for taking the time to speak with us today.
Good morning. Nice to be here.
Good morning to you as well. Now, October is Breast Cancer Awareness Month. What's new at Covenant Breast Health Center?
So we're very excited this fall to really kind of put into motion something we've been talking about for a while, and that was to develop a program which we call our high-risk breast clinic. And the idea is to be able to reach out to patients in the community and discuss issues with them that may put them at increased risk for breast cancer, and come up with imaging programs and plans for genetic testing and counseling.
And so who is considered high risk for this clinic?
Probably the easiest group of patients to find out about would be patients who have a family history. So it's really important that patients understand that they have to be their own advocates and really communicate to their physicians specifics about cancer that have occurred in their family, so that their physicians can kind of identify cancer syndromes that may be passed genetically, and they can be picked up by doing genetic testing and being referred to a center like this for genetic counseling and testing. There's some other things, for example, some women that have had treatment for lymphoma and had radiation to their chest, or certain types of biopsies that have occurred in the past.
So if someone is thinking about visiting the clinic, do they need a referral from their doctor?
Yes, they usually do. It depends on their insurance. I mean, we'll work with them if they call up and identify themselves as someone that would like to be seen. We can work with them, and it doesn't matter. We'll get them here one way or the other.
Okay, that is good to know. Now, the team at Covenant reminds and encourages people to schedule their yearly mammogram. Why are they so important?
Well, it's often debated. My philosophy has kind of changed over the years, but I really feel there's kind of a barbell approach to mammography, and this is supported by the literature and by the society I belong to, the American Society of Breast Surgeons. But for older patients, mammography may not save lives so much, but I truly do find on a daily basis that if an older patient comes in and we can identify her cancer, we're able to actually achieve cure from the cancer with much less toxicity and much less treatment, and those patients recover more quickly, and they're back in their quality of life for most of them, not everybody. For younger patients, mammography is really the only way that we have to identify their disease early if we can, and treat them for cure. And granted, younger patients usually have more aggressive cancers, and they have to be treated more aggressively. You just can't treat somebody if you don't know the problem exists. And so waiting until it becomes a large mass in the breast may not allow for cure. So, the sooner we pick things up, the better. And yearly screening mammogram with 3D tomography, which we have here, and I know it picks up breast cancers earlier than it did before, is beneficial.
Wow. Now, we are in the middle of a pandemic. A lot of people are nervous, whether they should go to the doctor or not. How are you guys working to keep people safe?
Yeah, that's a great question. As a medical world, we had to look at how to deal with COVID on so many fronts. And here in this center, we had to get together amongst the different specialties and come up with a team approach, both at the breast center where imaging is done, and also in the cancer center where we treat patients. And we developed guidelines, fortunately, which were agreed upon nationally with a lot of national bodies, and they had some support. And we figured out how to be safe and treat the patients that needed to be seen, and a lot of energy has come in to play to make sure patients that walk through these doors are safe. We did hold up mammography for a couple of months, but we reinstituted that. I think that patients need to understand that their safety is our priority. And I've seen a few patients that we've diagnosed their breast cancers a little bit late because they just couldn't get their annual screening mammograms. But for the most part, I think that patients are still doing well. There hasn't been a major catastrophe by missing mammography for a couple months. And I don't want patients to be afraid and think, oh, I shouldn't go in. They're going to find something worse. Mm-hmm. Just come in. If not here, somewhere else. and please get your screening mammogram. It's a benefit for you.
That is so important. Such great information. Thank you, doctor, for taking the time to speak with us this morning.
Thank you very much.
And if you would like any additional information about today's topic, just head on over to the Hot Links page on WNEM.com.